edition of the Premier Moment, we're going to take a look at the primal reflex release technique, otherwise known as PRRT, with the treatment on Olympian Chinwe Okoro.
Chinwe is, we're very proud of her, as a third-year student at Bellarmine Doctor of Physical Therapy School, and will graduate in May. And I've not seen her for a few years. She went to Russell High School and played basketball and track star, and then went on to college. What did you do your undergraduate work?
Yeah, well.
U of L. Oh my goodness.
Mm-hmm.
So I haven't seen you for a few years, so
Yeah.
it was great to get reacquainted.
Mm-hmm.
The reason she's here is she's had a little bit of back trouble, and she's going to South Africa to compete and see if she can get a spot on the Olympic team. If she competes and wins down there, you'll be an Olympic team for the shot put and discus.
Whichever.
Whichever.
I qualify
Or both.
for. Hopefully.
Okay, beautiful. What I'm doing here is I'm getting underneath her SI joints, and I'm just giving a little push here, a little push there to make sure they're equal. Yesterday, this one on the right side was locked, but I don't perceive that. Okay, now, yesterday this bothered you. Anything there? Nothing there? All right, Chinwe, you're very, very limber. And remember yesterday I was telling you, it's okay to be limber as long as you've got the strength to go with it. So we're going to test your erectors today, and we're going to test your obliques today.
Okay.
All right? And what we see with Olympians is that they become very flexible. If they stop doing their sport and lose strength, that extra flexibility causes them a lot of pain. Okay? So we want to cause balance in that. Now, the other thing I wanted to check was you said you're upper thoracic. Where about you having problems?
Right, midway.
Okay, because we got a good release there last night. At least I thought we did. Okay, it's right there. Another tight right there. Okay, let me look at the ribs again. Okay, we're good there. You know, the one thing I didn't look at is your suboccipital. Let me see. Do you remember the anatomy of the dura mater up through here? Okay, I understand. It's almost like a bat wing. It comes way out a lot farther into the suboccipital region than we ever gave it credit for. And Mr. Imes, who's founded the PRRT, says that this is a dumping ground for stress, so the dura mater holds all that. So one of the things I'm going to want to do is work back here. Let me check, see if I got anything in here. Okay, everything's good there. All right. Let me check here one more time. Okay, now last night that was stuck, but it's not stuck now.
Right there where your hand was.
Huh?
It's tender.
Over here?
Right there.
Right there? Okay, well let's do this maneuver again here then, because it's a little bit higher than what I think the next procedure will help you with. All right, here's what I want you to do. You're going to pull your arm in like that. Don't overbear me, just a steady pressure. Okay, eyes closed, and I'm going to tap on your obliques. Okay, pull on in. Pull, pull. Good, good, good. Keep pulling. Let's see if we got lucky with just being able to do one side. You tell me.
It's a little better.
Just a little, or is it completely gone?
It's a little better.
Little meaning on a scale of 1 to 100% better, where would you be?
50%.
Okay, that means we got to do the other side. All right, pull right on down, steady pressure, eyes closed. Pull, pull, good, 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 pull, good, good, good. All right, let's see what we got now, Chinwe.
I'm good there.
Good, 100%? Excellent, that's what we want. All right, stay right where you're at. I want you to put your hands together and elbows together best you can. Overhead. Oh, beautiful. I want you to push right up like that. Eyes closed. Now we're using the triceps tendon to down-regulate what's in the mid-thoracic. I couldn't do it with the last one, so I'm going to do it with this one. Now let's get your arms right here. Push up. Okay, and relax right here. Very good. And you're a little tight right there, aren't you? Does that hurt?
No.
Okay, now you're mobile, but you're still a little tight. Let's go at that one more time. Okay, hands and elbows together. Push up for me, dear. Atta girl. Seemed like it was more on the right side to me than the left side. All right, good. Now, I went at her pretty hard because she's obviously an Olympic athlete, and she's young and she's healthy. We've got to moderate this to the type of patient we're treating. If they may be out of shape, or if they're elderly, we have to go a lot more gingerly. Okay, let me have your arm right here. All right, let's do this and see if we can get that again. All right, when I push down with the reflex speed, you push up. Okay, eyes closed for me. The reason we close the eyes, Chinwei, is because you're taking thousands of data sets per second through your eyes to your brain. What Mr. Imes is saying, we want to calm that down so we can get more of the primal reflex release technique into that brainstem. Alrighty, so now when you feel me push down, you're going to reach up to the ceiling as quick and fast as you can, okay? Alrighty, good. That's it. Let me put you right here. Atta girl. And let's try one more. Bend your arms for me. Let me do this one for you. And just relax for me now.